Today's International Nurses Day. Please join me as I show you what it's like to be a community IV nurse in St Helens and Knowsley. My first job of the day is checking blood results to get organised and see what infusion medication we're going to administer to patients today. So we're going to see our first patient of the morning. She lives up in WN4 and she's on twice a day visits. So she's been supported by ourselves in the community nurse team up in Garswood. Community nursing enables patients to spend more time at home and get on with their life. Morning Beryl, you alright?
Yes, thank you.
Nice to see you. So Beryl, I'm just going to get everything ready.
Yeah.
So Beryl come into clinic at the start of a treatment to have this line inserted. It just saves her having a cannula every day, because once the line's in, it's a nice visit. So just to be in hospital for IV antibiotics is quite restricting.
Made a big difference. It's a lot easier, more comfortable in your own home.
The favourite part of my job is supporting patients in receiving IV medication at home so they're not admitted into hospital. The nature of our service means that patients can return to work rather than be unwell and dictated to by their long-term condition. And we try and facilitate discharges in a manner so the patients don't remain in hospital longer than they need to. A good example of that would be the Friday before Challenge Cup. We've got patients across the patch ringing up asking can they be discharged before the Saints are due at Wembley so they can get down there after they've had the dose in the morning, watch the team at Wembley, and then we can visit them subsequently the day after at home. So the next patient we're going to see is quite complicated. He's got Crohn's disease, chronic kidney disease, COPD, and we're going to pop in today, see how he is, and start his IV fluids at home. How are you feeling?
Good. Yeah, not so bad.
Austin's got a PICC line in his arm. We use an ambulatory pump so he can mobilise around the house with the IV fluids. He's able to go up and down the stairs to the toilet. He can go out and do his shopping if he wants to, or he can come and visit us in clinic and have his infusion taken down.
Instead of being in hospital 12 times a year, I'm sat in my own house watching my own telly. Brilliant. Can't thank him enough, mate.
Working in a community environment provides its own challenges. Having your nice clinical room and hospital bed is a luxury for us really. Working in a patient's home, there's a number of variables: infection control, children in the house. Sometimes we've had the Yorkshire Terrier doing the wall of death around the kitchen while we've been trying to put midlines into patients. Thanks for joining us today. Hopefully it's given you a bit of an insight in what I do as part of the community IV team.